Welcome to another edition of Journey of Hope. Stories of people that have been impacted by the healing ministry at Loma Linda University Medical Center. Loma Linda is treating approximately 750,000 outpatients every year, 30,000 inpatients. These are people that come from all around the world. People coming here seeking healing, hope, and happiness and wellness. Our special guest today is John Zulli. John was with us a few months ago. John is an author, a performance coach, a speaker, a martial artist, and a cancer survivor. John, it's good to have you back again.
Lynn, it's great to be here.
And we want to tell the audience a little bit about yourself and a little bit about your background before we get into what we're going to talk about today. So tell us where you're from and how you happen to come here to Loma Linda.
Well, I live on the central coast of California in a wonderful little area called San Luis Obispo. And about almost a year ago, just about now, I got that diagnosis that no one likes to hear, the cancer diagnosis, the big C, and it was a big shock to me. I've been a motivational speaker for almost 20 years. I've been, my involvement in the martial arts that you talked about led me into that, working with that thing called the mind-body connection, and I began to help other people to excel, whether it was on the golf course, in business, overcoming chronic pain, lowering blood pressure, getting a better night's sleep, those types of things. And I did that work since 1986.
So you've been doing it for quite a while then.
It's been a half an hour, 45 minutes, yes. Okay. I've been doing it for a bit. And so when I got the diagnosis, I consider myself to be an extraordinarily positive person. I live a very purpose-driven life. I feel like I'm 180 degrees out from what is known as a classic cancer personality. And it was a huge shock. Like many people that...
Now, have you been watching your health and taking care of yourself?
Well, Lynn, something we have in common. I've been a vegetarian for 25 years. I exercise regularly. I'm very good at managing my stress. So yes, I felt that I was absolutely the last person in line for prostate cancer. And it was a huge blow when I got the news. And like everyone else, just to kind of catch up, I went the traditional route. I looked at the traditional routes. They give you three options. It's radiation, it's yanking it out through surgery, or this cryo work where they freeze the prostate. Excuse me. None of those things seem to be the answer for me.
Didn't appeal to you?
No, but I went ahead and I scheduled surgery and figured, okay, I'm just going to tough out this. What has to be toughed out has to be toughed out.
Get it taken care of.
The one thing you can't do when you have cancer is ignore it. You have to do something. And I heard about Loma Linda through a remarkable series of events. Somebody that I hadn't talked to in almost 30 years came back into my life, and she just said, well, look at this website. I went to the website, and within 10 minutes, I was so excited. I was absolutely certain this is where I wanted to be. And now that I've had the therapy, I have to say that it's as if nothing ever happened. It's fabulous. It was a tremendous journey to be here, and to be able to deal with this very serious illness in such a positive and profoundly brilliant way.
So you were scheduled for surgery in a few days, and then you heard, well, as you've heard me say many times, nobody comes to Loma Linda by accident. It's a religious institution, and we don't make any apologies for it. Out of the hundreds of thousands of people that are diagnosed with cancer, only a few, relatively speaking, come here. Now, when you say it was a blow to you, what kind of a blow? I mean, are you Mr. Invincible and all? Well, what kind of an impact did this have on you?
Well, so I thought. I've considered that. I did some videos with Jack LaLanne, and I've always imagined that I would be very much like Jack, just keep going into my hundreds. Never take a day off, never be sick. And I am that classic person. I don't get sick, and so to me, it was as if I got the rug pulled out from underneath me. And I was embarrassed. I was ashamed. I didn't tell anyone because, here now I'm thinking to myself, well, who am I to teach anybody anything? I must have done something to deserve this. I must have done something wrong.
Violated something.
Some rule, or maybe I had too much sugar as a kid or something along those lines. And that was also very, very foolish. When DNA was when they handed out the cards of DNA, I got a bad hand, and that's all there is. That's how I look at it, and that's how I've come to internalize it. Now it's very different. I realize that, you know, these things do happen to people no matter what. And I'm very open about discussing it with other individuals. Another thing, too, I didn't talk very much about it because I absolutely hate that look in people's eyes when they go, oh, you have cancer, and they're writing you off, you know, and now they see
Poor
you as a
guy.
victim. Yeah. Well, maybe you shouldn't work out so hard. Maybe you shouldn't take those jobs next year, which is exactly the opposite. So there was a lot of, it was very difficult at first.
Kind of kept it yourself.
Exactly. And now, you know, I'm thinking I'm a pretty smart guy because I ended up here and took a therapy that I believe in my heart is going to be the cancer treatment of this century. Absolutely, hands down. Proton therapy, not just for prostate cancer, but for all the, 44 different types of cancers that Loma Linda's working on. It is going to be the treatment of choice. As soon as we can get enough of these centers built, I don't see where anybody's going to do anything else.
Well, you know, it's a frightening thing when people hear and are confronted with the words that you have cancer or some other disease. And I have to remind people that it's a diagnosis. It's not a death sentence. You know, we've come so far in the last several years with even all the different type of modalities of treating cancer. But it's a very fearful thing. And I had you speak this last night to our prostate cancer patients and the other cancer patients, and you talked about this matter of fear. And let's spend a little bit of time on fear and overcoming fear, because that's a part of the healing process. As you know, the treatments or the surgery, whatever it is, that takes place over in the medical center. But healing is a process, and there are many, many different facets to it. And when our patients come here, we try to keep them involved in a number of different things. You know, the undergirding philosophy of Loma Linda is to make man whole, mentally, physically, spiritually, emotionally. And there are many, many different components to that. And people can become an active part of the healing process. But fear is a great inhibitor. And I know it's a frightening thing. I ended up spending a couple of weeks ago my time in the hospital. I got bit by probably a little spider, just an innocent little thing, and ignored it for a couple of days. And then they put me on antibiotics, and it didn't do any good. And finally put me in the hospital, and I was on getting antibiotics over a period of about 3 days. And hospitals are a good place to stay away from.
No place for sick people.
Doesn't matter where the hospital is. But many people, you know, as soon as they find out that they've got this a disease, find out they're going to have to go to the hospital, there's an overwhelming fear. How do people deal with fear? And what, you know, you shared some things last night. Well,
here's, you know, you asked how was I impacted, and partly it's a feeling of helplessness. When we descend into helplessness and we descend into hopelessness, many bad things occur within us. You said it's an inhibitor. Fear is an inhibitor, not just of our actions or our ability to use our minds on our behalf, but fear also inhibits the immune system. When we become frightened, it debilitates the immune system.
Irregardless of what the fear is.
Doesn't matter what you're afraid of, whether you're afraid of snakes, whether you're afraid of public speaking. And here's the other part. Short-term fear is not an issue. Acute stress will never hurt anybody. It's that chronic stress that will wear you down over a period of time. And the reason is that stress, what you focus your mind on, that's causing the stress, is going to have a tendency to release stress chemicals into the bloodstream. When that happens, the body begins to break down, and because it's not getting what it needs. Those stress chemicals do great to get your heart beating faster, to get your muscles tense, and so forth. They don't do very much for your immune system. So we know for a fact.
Flight or fight type of thing.
Precisely.
Immediately.
And when you can't get out of fight or flight, you're in a lot of trouble. We know that fear affects the immune system, it affects the endocrine system, which is controlling all the hormones in the body, and last but not least, it affects the autonomic nervous system, which controls almost every major organ in the body. You know, 20 years ago, Lynn, when I started talking about fear and stress and what the mind can do for you, this wonderful gift that God has given us, you know, how to use that gift, how to put it to work for you. A lot of times people would say, well, that's just anecdotal evidence. We don't really know that. Well, now we have a new field that's come out. It's called psychobiology. And while that sounds like good science gone a little crazy, all really psychobiology does is measure the impact that your thoughts are having on your physical body. And psychobiology has taught us many, many things. One of them is that chronic stress is making you older, it's making you more tired, it is causing people to die younger, they can't recover from illness. Stress may or may not cause your illness, but it's going to make it worse.
When you
Or
talk
it's
about
going to make it
chronic stress,
longer.
you're talking about long-term then.
Day to day, in and out fear. There was a study that was done, it was a quite interesting study. It was done of women who were taking care of chronically ill children. And what they, these individuals couldn't get out of the stress cycle. I mean, they're taking care of a child who's terminally ill, is going to die.
Around the clock.
Exactly. And what they found is they examined their DNA strands, and they found that the DNA strands of these women were actually fraying. They were aging faster. Now, the good news is that once the problem had passed, or once the issue was over and resolved, then as these women began to go into their daily routine, break free of that chronic stress, their DNA strands began to repair themselves.
Really?
So what we have here is we know that chronic fear, I mean, fear is a good thing. You climb mountains, I do
Right.
some rock climbing, and we all know that the climbers without fear died a long time ago.
right.
Fear's got a
Right.
purpose in life. It's not the worst thing that ever happened. It's what got me to Loma. I was so scared of that surgery, I was going to find an alternative, and through the grace of God, I did. So we know that short-term fear is not a bad thing, but this chronic fear will break your body down, and it's imperative to do something to break that cycle, because that's what it is. It's a cycle of fear, and you begin living your life like that. And I don't think that God would like you to live your life in constant fear.
No, I think that's absolutely true. And of course, the patients that we have coming here all the time, they are dealing with it one way or another. And apparently, you've written a book here, The Mind Rules. What are we talking about, the mind rules?
Well, there's certain, so as I said, for over 20 years now, I've been helping people to live, work, and compete at their peak. And what I noticed was there were certain concepts and ideas that are universal. They affect everyone. And that's what this book is. It's about those mind rules that affect people. Let me give you an example. The first rule of the mind is that every thought creates a physical reaction and an emotional response. So whatever you focus your attention on there's going to be a physical reaction. And people say, well, what are you talking about? Well, if you watch a pizza commercial on television and your stomach begins to growl, you now understand that every thought has a physical reaction and an emotional response. You're either going to be emotionally desiring pizza, or maybe, it's not that important.
But it's creating
to
some
you.
kind of a bodily response to it, then, is what you're saying.
Exactly. And we measured this now. As I said, we now know that there are chemical changes that take place. So the question really becomes, what are you focusing your attention on the vast majority of the time with a high degree of frequency? As we said last night to the group, psychobiology tells us that each individual has approximately 60,000 thoughts each and every day. 60,000 thoughts sounds like a lot of thoughts. That's the good news. The bad news, Lynn, is that about 90% of those 60,000 thoughts are the thoughts that you had yesterday and the day before that and the day before that, which means that all this mind power, this fabulous tool that you have, is narrowly focused on a very, very short band of ideas and concepts. And that information is affecting you. So the first thing the person has to ask that's looking to break this cycle of fear is, what do I focus on? What am I paying attention to an awful lot? Let me give you a small example of how attention changes. When I got my diagnosis, I was terrified. When I came here and spoke to Dr. Bush, he explained something to me that no physician had done. He said, 10% of one side of your prostate is involved in cancer.
10% of one side.
Of one side. He said, 1% of the other side is involved in cancer. He says, you realize what that means? And of course, I sat there with my mouth open going, no.
I got cancer.
Exactly. And he said, that means that 90% of one side is healthy and 99% of the other side is healthy. It changed my attitude. I felt a sense of hope. I felt some control. And I began to think, hey, this sounds like I can beat this thing instead of it beating me.
Well, really, it's a matter of control, isn't it? And the loss of control and things being out of control. That's where all these fears come in. Well, and we're attempting to do a number of different things to help patients when they come in here. And you may have some suggestions for us. And your book here, tell us a couple of the other rules here in the mind that may have an impact upon people and that had an impact upon you when you were here.
Well, here's another rule, and that is that tension impedes performance. tension impedes performance. And it doesn't matter if that performance is out on the golf course or the healing process is going inside of you. You know, when you notice that you're wearing your shoulders as earrings, okay, and you realize how uptight you have become, I love that term, uptight, because that's what we are. Yeah. And when you become aware of those things, that's not natural. Dr. Herbert Benson, who wrote the Relaxation Response book, an excellent book, I might suggest, he pointed out that no, that chronic knot that you have in your neck is not natural. It's your body telling you something's out of balance, something's wrong. The simple act of learning how to relax the muscles in your body will break that stress cycle. It will change the chemical makeup of your body, and it will help you to have more energy.
Learning to relax.
It is an age-old process that in our society now, because of the speed that we're traveling at, you know, it used to take you 6 months to get across the country. Now you can do it in 6 hours. This type of pressure, we've never had to deal with this before. You know, in the next 24 hours, you're going to take in as much information as a person in medieval times took in their entire lifetime.
That's staggering.
And all that information needs to be processed. And this is why we see 60 million Americans have frequent or chronic insomnia. So the idea of just learning how to physically relax, and I mean really, truly 100% relax your body, is one of the healthiest things that you can do for yourself. It's so simple. You know, when you talk about being able to focus your mind on positive things, on things that you can control, and you learn how to relax your body, the benefits are dramatic. Lifestyle issues, if you make some little adjustments in these things, the change that takes place is huge. If we could put all the benefits of focusing on the things you can control and relaxing your muscles in a pill, Lynn, they'd be lined up for miles to get it. But if you can take 10 or 15 minutes out of your day, even right before you go to sleep, to discharge that stress and tension, to physically relax, and I mean really relax, what will happen to you is nothing short of a miracle. And these are gifts that have been given to you. It's just being able to use your mind and body.
Well, looking back on your experience here, a few months back now, getting several months back, what are some of the things you think that we were doing that would help in the healing process and applying some of these mind rules?
Okay, one is that you do such an excellent job, you and your staff, making sure that people don't get isolated. Because when I sit in the corner and I think, I'm going to die, I'm going to die, I'm going to die, no one can help me, it's hopeless, it's over.
Woe is me.
These things, they lead to depression. In fact, there was a study where people have learned to depress themselves by adopting a depressed physical posture and by repeating over and over to themselves, it's hopeless, it's helpless, no one can save me. So here at Loma Linda, you go out, you seek people out, and you encourage them to get together as a community. As they begin to interact and they begin to hear stories of hope, that's the other thing that you do. Bringing the alumni back into your group therapy meetings, and I hardly can call them group therapy meetings, but into the meetings or community meetings.
Educational meetings is what we'll call them.
There you go.
Right.
When they hear somebody come back and, you know, they're cured, or if they're successful, let's put it that way, it is uplifting and it is energizing to people. Those two things, making sure people don't become isolated and trapped into negative thinking, and hearing stories of hope, just like this show, is so inspirational and so invigorating to people that their 9 weeks start flying by here, and the time that they spend here starts flying by, and they barely even think about the fact that, hey, I've got the big C. You know, people don't understand. We're not doing so well on the war on drugs. We certainly haven't won the war on poverty. War on terrorism is still going on, and it's a debate. But we are making inroads in the war on cancer.
You're absolutely right.
And so, again, when you come here, and there's everything about this facility. I'm so impressed with the attitude of the staff. This is the difference between client-centered care versus practitioner-centered care. You get the impression that the people that work here really do care about you, and that they're here to make your transition as positive and as empowering as possible.
Well, you know, the little badges we have, they're called you're called a guest. And you know, we do everything we can to have a. I've been waiting for you to talk about the approach here that we have for exercise and the impact that that makes.
Okay, here's again, encouraging people and having this fabulous facility, the Drayson Center. What a remarkable facility anywhere. I mean, if it was a university, it doesn't matter. It is a remarkable facility. And the point of exercise is another way that we can discharge that stress and tension. Let's face it, if you are physically fatigued from exercise, it's going to be hard to develop a little mental anxiety. There was a study done at Duke University in 2001 in which they took deeply depressed, not moderately depressed, but deeply depressed individuals, and they put them on an exercise regime of 40 minutes 3 times a week. Supervised exercise. That means they were really exercising.
But for 40 minutes, 3 times.
A week. And what they found they found that those patients that went through that program got as much relief from the exercise as they did from a very popular antidepressant pill.
Really?
So we know for a fact that again, lifestyle issues, making small changes in what you eat, cleaning up your diet, being sure that you're not taking in too much caffeine, too much sugar, or any at all if you can go that route. Getting out there and becoming physically active, one of the healthiest things you can do for yourself. Why do we have so much stress and tension? Well, it's about we perceive threats. We perceive threats, the body becomes energized to deal with the threat. The problem is that, the caveman's response of fighting or running away isn't appropriate with your boss or your spouse, or whatever problem that you have at the moment. So you've got to do something with that adrenaline. You have to do something with that energy, and if you don't, it just compounds itself and it becomes tension in the body. You wonder, why does the body become so tense? It's to ward off a blow. When you become stressed, you're feeling that that sense of threat, you're tensing up as if you were going to get into a fight. And physical exercise is one way that you can discharge that stress and tension. One more thing. When we talk about relaxation, in 1929, a doctor by the name of Edmund Jacobson did some very interesting research into relaxation. And you know what he found? He found that it is impossible to be mentally anxious and physically relaxed at the same time. You cannot do it. So when you talk about somebody who's riddled with anxiety, maybe if they could relax their body, they could pull themselves out of that mental trap, that cycle of fear that we know is causing them to lose their health and age faster. But just being able to relax will cause that stress in your head to clear up, and I can't think of any more pleasurable way to.
John, we have people from around the world, on all the continents, I think, except Antarctica, people are watching LLB. And there are people watching right now that this week or this past week, they were confronted with some very sobering, frightening news. Some kind of an illness, some other kind of event in their life. What would you tell, we're talking about the importance of relaxing and a number of different things. What would you tell the audience, a couple things that they could do to begin to cope with something they've just been confronted with?
Okay, the first is to use something I call the 180-degree rule. And that is just look on the opposite side. Whatever it is that you do, whatever it is that you're feeling, whatever it is that you're thinking, what would be the exact opposite of that? And when you look on that opposite side, what you'll find very often is that there's an insight or there's a piece of information or some new knowledge that comes your way. And sometimes it's just ridiculous silliness. But what you do is you're breaking free of that one track and you're looking into other possibilities. You see, we don't really get stressed until we don't have choices. We don't really get stressed until we don't have options. And when you use this 180-degree rule, look on the other side, you might find an option or two in there that'll help out. The other thing that I would recommend to somebody is focus on, fine, you want to be afraid, that's fine. Use that fear. Mobilize yourself. Get information. Talk to people that have been there. Get out and find out what other people have done in your situation, because you're not the first that have gone through whatever this event is. You're not the first. The next is exactly what I was saying earlier, and that is to just do something simple as relaxation. Now, if they're watching the show right now and they're feeling tense and nervous and uptight, the easiest thing to do is take in a deep breath, and when you do, you take in that deep breath, I want you to tense all the muscles in your body and hold that breath. So you're taking a deep breath, tense up those muscles nice and tight, and when you exhale, I want you to exhale vigorously and relax completely. If you do that 3 times, breathe in, tense up, exhale, and relax, you're not going to have a lot of tension left over in the body. That's one quick way to discharge stress and tension. I've seen that work for people on the Senior Pro Tour. I've seen it work for people who are dealing with extraordinary pain.
That is wonderful counsel. You know, we've got just a couple of minutes left here. If somebody wanted to get this book, The Mind Rules, how would they secure a copy of this? Or the tapes or whatever?
The best place right now is Amazon.com, and they can also check out the website, which is johnzulli.com.
Okay.
That's Z-U-L-L-I.
Z-U-L-L-I. And it's a wonderful book, some very helpful information here that's going to make a difference in people's lives. We got just a minute and a half here left. What difference is having cancer making in your life?
You know, many years ago, I worked with a man who had brain cancer. Walked with a limp, half of the side of his face was drooping. He was obviously had gone through quite a bit. And he looked at me, and as we were talking, he says, you know, if I had to go back and live my life the way it was and not have the cancer, or have the cancer and now have the life that I have, he says, I wouldn't go back there. That's, you know, that when I heard that, it was inconceivable to me. I'm looking at him and I'm thinking, you must, you know, that really must have addled your brain. But when I engaged in the process myself, a couple things happened. One is I began to realize how precious. This is a limited engagement. This is not a continuing event. And I feel that I've been given extra time. And the time, I now want to use that time to really contribute and make as big a difference in this world as I possibly can. It's energized me, Lynn.
Well, I can see that it's energized you, and I know that you're going to be coming back and speaking to our patients in the future, and we're going to be sharing this book here. For those that are watching from around the world, we're glad that you've been able to listen to John, because John's hit some very significant points for each one of us and able to make a difference in the way we cope and the way we react and the way we respond. For those of you that are looking on, I'm Lynn Martell for Journey of Hope. And once again, you've seen an individual here that's been impacted by the healing ministry of Loma Linda. They've gone on to experience hope and healing and wellness and a change in their life. Some of you this week have been confronted with some very sobering news. I want to tell you that if you'll give God a chance with your life, He'll open doors and close them. He's got a plan for you. Give Him a chance. He's waiting.